Good morning, my lovely nurses. I hope you are fine and your family is good. So, this full week we are doing the dosage calculations, the practice. So, today our lecture is the first part of this lecture is safe dosage ranges. Safe dosage ranges. What is safe dosage ranges? Safe dosage ranges mean sometime uh, uh, the doctor order the wrong dose, mean maybe that is excess dose, so we have to clarify with the doctor. Sometime doctor order the less dose, so the nurse should have to know how maximum dose patient need per day, is either this dose is low or high. So we will discuss today and we will practice the question also. So the safe dose range, we can say maximum daily doses. The nurse should have to know maximum daily doses. The nurse should have to know the idea, and she should have expert how much maximum daily dose the patient will receive per day. Then maximum ranges, maximum ranges, that also the nurse should have to know. The minimum maximum ranges mean if the too low is not effective, if the medicine is too low is not effective, and if it's too high it will be toxic, not good for the patient. So the nurse should have to know about this one. Then when calculating the safe range for a client, when calculating the safe range for a client, so what nurse should have to know? Minimum dose per kg, minimum dose multiply kg low end, and she also have to know maximum dose multiply kg high end. So the nurse should have to know the minimum dose, how much minimum dose per kg that is suitable for the patient, and how much maximum dose high low end mean the, for example, we can say the 10 milligram is low for the patient, so 9.5 milligram is minimum, the low end, that is low end. And we will say if, for example, 10 milligram is high for the patient, so 10.2 milligram is mean high end. So this, the nurse should have to know the ranges of the medicine, the maximum dose and the minimum dose. Now if a medication is outside of the normal range, do not administer. If the medicine is too low, should have to clarify with the healthcare provider. If the medicine dose is too high, should contact to the healthcare provider for the clarification. That is safe dosage range. We will do one practice question. So our question is, while rounding on your client in the morning, the primary healthcare provider states that they are in fluid volume excess. They are in fluid volume excess and need additional diuretics. The patient has fluid volume excess and need additional diuretics despite already taking Lasix daily. Patient already receiving Lasix daily, and doctor again is telling we need the more additional diuretics. Your client Your client is a 2-year-old. Weight is 18 kg. The doctor ordered chlorothiazide. Chlorothiazide is the diuretic. Chlorothiazide. The order read, when you read the order is chlorothiazide 10 milligram per kg POTID. So doctor write, patient already on the Lasix, and the doctor write, tell the patient need additional diuretics, and he order chlorothiazide 10 milligram per kg POTID. So what is the nurse priority? Nurse check the label on the medication and the drug administration guide and find the following. The nurse is reading the nurse read the label on the medication, and in the drug administration guide and find the following, So doctor order already, but what is the nurse priority? To check the label on the medicine, and she checked the administration guide that is available in the medicine, and what she found? She found the concentration is, the drug concentration is 250 milligram per 5 ml. The concentration is 250 milligram per 5 ml. Is also mentioned on the administration guide. Safe pediatric dosage range. What is safe pediatric dosage range? Is 5 to 10 milligram per kg per day. Is mentioned on the administration guide. The concentration is 250 milligram per 5 ml. The safe pediatrician dose range is 5 to 10 milligram per kg per day, not to exceed 375 milligram per day. This is our question. So while rounding on your client in the morning, the primary healthcare provider state that they are in fluid excess and need additional diuretics despite already taking Lasix daily. Patient is already on the Lasix, and your client is a 2-year-old, weight is 18 kg. So what he ordered? Chlorothiazide 10 milligram per kg POTID 3 times in a day. Once the nurse read the label on the medicine and in the administration guide, what she found? She found concentration is 250 milligram per 5 ml. The safe pediatric dose is 5 to 10 milligram per kg per day, and not to exceed 375 milligram per day. Now, what's the nurse best action? So, what is our question now? So our question is, which of the following is the priority nursing action? Which of the following is the nursing priority action? So which is the priority nursing action? Number A, administer the medicine. Number B, prepare the medication and notify pharmacy. Prepare the medicines and notify the pharmacy. Number C, contact the primary healthcare provider. Number D, educate the family. about diuretic therapy. About diuretic therapy. So 4 options they give us. They already inform us about all the patient need additional diuretics. Doctor order already. Now administer the medication, prepare the medicine and notify the pharmacy. Contact the primary health care provider and educate the family about medication, the diuretic therapy. Now, if we will calculate, then we will check what is our correct option. Now, first we will see the chlorothiazide. How he ordered 10 milligram per kg POTID. So first we will multiply 10 milligram to 18. So first of all, 10 milligram multiply 18 is equal 180 milligram. 180 milligram of this chlorothiazide. So patient need one time dose, he need 180 milligram. But doctor ordered TID 3 times in a day. So if we will do 180 milligram multiply 3, 180 milligram multiply 3 is 540 milligram of chlorothiazide. So patient need 540 milligram, that is doctor ordered 540 milligram per day, that is per day dose. So on the label of that the medication nurse took from the pharmacy, what is mentioned on the label? The not to exceed 375 milligram per day. So is already mentioned on the medicine not to exceed 375 milligram per day, but the doctor ordered 540 milligram per day. So this is excess dose. So what nurse will do? This is not safe dosage of chlorothiazide to administer to your client. What is the priority nursing action? Is to contact the primary health care provider. The nurse should never administer the dosage of medication because she believes it to be, this is unsafe, and it is the part of our 6 rights of medication administration to check the dosage before administration. So before administration we have to check the medicine, either this is safe or unsafe for our patient. So the nurse knows this is unsafe for our patient, so we should have to make the question with the patient, and we will tell the primary health care provider to clarify again, verify again, because this medicine dose is not safe for the patient. Now our next method is rapid rate calculation. Drip rate calculation. How we will calculate the drip rate? We are talking about drip rate. So first I will tell you the formula. The formula of drip rate calculation is amount to be infused multiply drops, and the drops we are in the question mostly write GTTS. So GTTS mostly we are using for the drops. So any mostly in the question you will, with the drops you will find GTTS. So amount to be infused multiply drops per minute, and divided by minutes for infusion, So what is our formula? Amount to be infused multiply drops per minute divided by minutes for infusion. Now the drops in the question you will found GTTS, and the drop factor is the drops per minute that flow out of the IV tubing. For example, for the micro drip tubing has a drop factor is 60. The microburette we are using, no, So micro drip tubing, micro drip tubing drop factor is 60 GTTS per minute. The drop factor always provided in the question. They mention in the question the drop factor. Micro drip tubing drop factor is 60 GTTS and they always mention the drop factor in the question. So now we will do one practice question. The practice question, the nurse prepares to administer ciprofloxacin IV. This medication is supplied as 200 milligram of ciprofloxacin diluted in 100 ml D5W dextrose 5 water and is ordered to infused in 30 minutes. The nurse does not have access to an IV pump, and must give this medication by gravity. With tubing at 15 GTTS per ml, that is the drop factor. With tubing at 15 GTTS per ml, what is the rate the nurse should infuse this medicine? So the question is, the nurse prepared to administer ciprofloxacin intravenously. This medicine is supplies as 200 milligram of ciprofloxacin. So in the pharmacy, she received 200 milligram ciprofloxacin diluted in 100 ml D5 water, and doctor ordered should be infused in 30 minutes. But the nurse don't have the IV pump, but this medicine should be given by gravity. So with tubing, they said the which tubing she should have to use 15 GTTS per ml, that is the drop factor. What is the route the nurse should infuse this medicine? So we will use their formula. What is our formula that I give? The formula, the nurse should have to use the amount to be infused. So how much the amount to be infused? What is amount? 100 ml. This is amount. Then multiply drops GTTS. How many drops? 15. Then divided by the drops, the minutes for infusion. So what is the minutes for infusion? Doctor said in 30 minutes. Divided by, so amount to be infused is 100 ml. The drops is 15 and divided the minutes is 30 minutes. Within 30 minutes should be infused. So if we will multiply 100 multiply 15 and divided by 30, our answer will come 50 GTTS per minute. So the nurse should be infused this ciprofloxacin the 50 GTTS per minute. This is our right answer. I hope you like the lecture. If you like, please share and subscribe my YouTube channel. And don't forget to push the icon bell button so you can receive my coming videos notification. Thank you very much Inshallah, the next we will continue this one. The drip rate calculations is not yet finished. Keep me in your prayers. Take care of yourself and your family. Allah Hafiz.